People, thank you so much for coming back to this channel, and if you are new to this channel, please feel welcome and make sure that you subscribe, share the videos and like them so that we can grow this community of people who help one another to achieve their American dream. Yes, my name is Bosco. I'm a registered nurse in Uganda, Kenya and the United States, and I help fellow nurses with Nclex review and guidance here and there along their pursuit of opportunities abroad. So today I want us to help those who have been asking me, how hard really is the Nclex exam? How hard is that exam? That is the question on every nurse's mind. And today I try to set questions that mimic the hardness that I saw personally. So there is a disclaimer here. This is completely according to my experience at the Nclex Center in South Africa. This may be different. This experience may be different from what another person saw, but I have tried to be as honest as possible. Another disclaimer is that I don't mean that these are the questions I saw in the exam. And if there is any question appearing here that has ever appeared on the Nclex, it is completely by coincidence. Alright guys, let's go! So, question number 1. The nurse is developing a care plan for an older client being admitted to a long-term care facility. Which information should the nurse use to plan interventions for this client? Select all that apply. So guys, we have an older client being admitted to a long-term care facility. What applies to old patients is what we should select here. Older clients tend to be incontinent. Is that true? Older clients are at risk for dehydration. Is it true or false? That is another approach for select all that apply. Ask yourself, is it true or false? So, older clients tend to be incontinent. Older clients are at risk for dehydration. Depression is a normal part of the aging process. Age-related skin changes require special monitoring. Older clients are at risk for complications of immobility. Confusion and cognitive changes are common findings in the older population. Okay guys, so what are going to be your selections of all this? Please write your answers. Maybe you can write 1, 3, 5, 6, and then we can find out what the answer is. Okay? Alright, the answer is only 2, 4, and 5. So the rationale is that older clients are at risk for dehydration and complications related to immobility. Other abnormal physiological changes that occur during the aging process include loss of skin integrity. Now be careful whenever they say depression is a normal finding in the elderly. You don't bring an abnormality and you call it normal finding. So incontinence, depression, confusion, cognitive changes are not normal findings of the aging process. Question 2. The nurse is admitting a 70-year-old patient who fell at home and sustained a femur fracture or fracture femur. Monitoring for which of the following complications would be the highest priority for the nurse. So remember guys, on the Nclex they will give you, what they are going to give you down here are all complications. Moreover, they are all complications that need frequent monitoring. However, you have to choose which one is priority, okay? So they have given you bleeding from the injury, fat emboli, compartment syndrome, disseminated intravascular coagulation. What are you going to prioritize?
Okay, so these are the questions that you are going to find on the Nclex. I mean, this is how tricky they are going to be, whereby you see everything as if it is a possible answer. Okay, so the answer is B. Although the rest of the conditions need to be monitored and addressed, fat emboli take priority in long bone fractures. And you know why? Here, the answer you choose is what causes the patient to die faster. Okay, so moreover, the other conditions, although the other conditions can cause death or they are likely complications of fractures, if the patient developed a fat embolus, this embolus would go and obstruct maybe a coronary artery, and that can cause a myocardial infarction. If this embolus went to the one of the vessels in the brain, it can cause ischemic stroke, which can cause really a faster degeneration, neurological damage. So that's why it takes precedence over the other options. Whereas, for instance, look at this disseminated intravascular coagulation. I don't expect this to occur in long bone fractures easily, but I would expect DIC to occur in major cardiovascular events like postpartum hemorrhage, like sepsis. Those ones I can really pay attention to that. Bleeding from the injury, really, if it is a fracture that is femur, I don't expect the skin to be exposed, so there will be no bleeding really from the injury. However, there can be internal bleeding, especially if major vessels have been damaged. Okay, compartment syndrome is a likely complication. However, this can give you some time. This can give you some hours, but fat emboli may not give you much time. So you need to intervene as fast as possible. Alright, question number 3. When teaching an interpartum client about the passage of the fetus through the birth canal during labor, the nurse describes the cardinal mechanisms of labor. Place these events in the sequence in which they occur. So this is known as a drag and drop question. You are most likely going to get a drag and drop, maybe two questions or 3 on your Nclex. So you read through the options and then you arrange them in order. This question requires you to have knowledge on the mechanisms of labor. So what happens first before the baby comes out? Is it flexion? Is it external rotation, descent, expulsion? Of course, you would know expulsion would be the last. I wouldn't think of expulsion as the first. So I would drag this and put it as, I would drag expulsion and put it as the real last here. Alright, so internal rotation, extension. Alright, so what would you put as the first and what would you put as the last? Arrange that to reflect the mechanism of labor. Okay, so write your answer down. You can write your answer down so that we find out what the order is and whether you are getting it or not. Okay, so this is the order. First of all, the baby is descending. I'm going to show you shortly a video on that. I mean how it occurs. So descent, flexion, internal rotation, extension, external rotation, and expulsion. So check this next video. Check the following description of how this occurs. Question number 4. Which serious complications may result from alcohol withdrawal delirium? Select all that apply. Guys, whenever you get a select all that apply on the Nclex, feel happy. It means that you were doing well on the previous questions. It might mean like that, okay? So, number 1. So we are looking for complications of alcohol withdrawal. Can the patient get a myocardial infarction? Can the patient get electrolyte imbalance? Can the patient get aspiration pneumonia? Can the patient get anaphylaxis? Alcohol withdrawal? Can the patient get sepsis? Can the patient commit suicide due to that? Alcohol withdrawal complications. So select all that apply. Alright, select your answers, write them down so that we find out whether you passed or not. Okay, so the answer is 1, 2, 3, 5 and 6. So here the only answer that has not been considered as part of the answers is anaphylaxis. Otherwise the rest would be okay. So remember, anaphylaxis comes in when you have added something to the body, so the body is reacting it. It's an allergic response. However, if the patient has been on alcohol and is now withdrawing from it, in other words, has not taken alcohol for some time, it cannot be, anaphylaxis cannot be expected. Number 5. What is the nurse's priority intervention for a client? What is the nurse's priority intervention for a client with the rhythm? Okay, so this is the rhythm. Okay, so first of all, try to interpret the rhythm, and then let's see the options for that rhythm that you have interpreted it is. Let's see whether you can know which option is the right intervention. Administer miodaron as prescribed. Do you administer miodaron here? Administer adenosine 6 milligrams, rapid IV push. Continue monitoring the client. Administer atropine 1 milligram every 3 minutes. Okay, so let's see what the answer is of these 4 options. The answer is C. And what is C? Continue monitoring the client. Okay, first of all, the rhythm, did you get it? This is a PVC, premature ventricular contraction. We see we see that this heart rate is okay. So we see that there is this heart rate is regular all the way until you get an interruption. Okay, remember that once the ventricle is initiating its own contraction, in other words, the origin of electrical activity in the heart, once that origin is from the ventricle, there is kind of a bizarre appearance of this QRS complex. As you see, this QRS complex is larger than this, kind of bizarre, okay, because that electrical activity is originating from the heart. So you can see that then the heart rate gets regular, and then finally again we get this bizarre behavior because of a premature ventricular contraction. So PVCs, guys, should not be, it's not something to worry about. However, it's something to be monitored. Once the PVCs are too frequent, then it means that rhythm may easily turn from just PVCs to, say, an abnormal rhythm, a life-threatening rhythm like ventricular fibrillation. Okay, so here, once on the cardiac monitor, you are just seeing these PVCs, they are not so frequent, just continue monitoring the client. Alright, number 6. A student nurse is delivering education on pregnancy and alcoholism. The nurse intervenes when she mentions the following statements except. So what this means, guys, is that all these clients, all these statements are wrong. Okay, all these statements are wrong. The student nurse is saying wrong statements, but the nurse should not intervene on one of these statements because it is right. So we are looking for a right statement. So which is the right statement here when the student nurse teaches in relation to alcohol in pregnancy? Binge drinking is less detrimental to the fetus than low-level chronic drinking. So is that a right or wrong statement? And should the nurse intervene? Yes, the nurse should intervene, maybe because the statement is wrong, or the nurse should not intervene because the statement is right. So what is your say? The mother's blood alcohol level is greater than that of the fetus. The fetus can stay inebriated for many days. Fetal blood alcohol levels drop off quickly. Nclex like exam. Okay, so to some of you this might be so simple, you would already have identified the answer, but for many of us, I know this can look like everything is strange. Alright guys, so write your answer down and we'll see whether you are right or wrong. So the answer is C. All the other statements were wrong and the nurse should intervene, except for C, the fetal liver isn't mature enough to detoxify the alcohol. So binge drinking is more detrimental to the fetus than chronic low-level drinking for this reason as well. Alcohol goes directly from mother to fetus at the same level of concentration. No saying the concentration in the fetus is higher or lower. High fetal blood alcohol levels stay that way for a long time. Okay, I hope that is understood, guys. So let's go to the next question. Question number 7. Another SATA. And that's how the Nclex might look. Okay, the nurse is preparing to teach a group of clients on the neurosurgical units on the signs and symptoms of GBS, Guillain-Barr Syndrome. Which of the following will the nurse include in her teaching plan? Select all that applies. So first of all, try to identify. Guillain-Barr Syndrome is a disease of which system? Is it the cardiovascular system? Is it the nervous system? After you have identified the system, then try to see which of the following symptoms are related to that system. Okay, first of all, dysphagia. Would you select that? Paresthesia. Would you select that? Facial weakness. Would you select that? Difficulty speaking. Is that affected in GBS? Hyperactive deep tendon reflexes. And whenever they give you an option like this, are they hyperactive? This is a key term, a key word. Are they hyperactive or hypoactive? Descending symmetrical muscle weakness. So in GBS, do we see descending symmetrical muscle weakness or ascending symmetrical muscle weakness? Or ascending, it can be symmetrical, it may not. So try to look at those keywords and examine them closely. Okay, write your options, guys. Let's go to the other side and see what the answer is. Okay, so the answer is 1, 2, 3, 4. Okay, so Guillain-Barr syndrome is an acute autoimmune disorder characterized by varying degrees of motor weakness and paralysis. Remember, guys, in GBS, there is auto-destruction of the myelin sheath on the neurons. So that means this is a disease of the nervous system, an autoimmune disorder that affects the nervous system. So most of the symptoms you would choose are those of the nervous system, but be careful with those that had tricks. Okay, so look, motor manifestations include ascending, not descending symmetrical muscle weakness that leads to flaccid paralysis without muscle atrophy, decreased or absent deep tendon reflexes, decreased, not increased, respiratory compromise and respiratory failure and loss of bladder and bowel control. Of course, because these organs are innervated, and to function well, the nervous system must be functioning also. Sensory manifestations include pain, cramping, and paresthesia. Cranial nerve manifestations include facial weakness, dysphagia, diplopia, and difficulty speaking. Autonomic manifestations include labile blood pressure, dysrhythmias, and tachycardia. Okay. Then guys, number 8, a primary healthcare provider prescribes 1,000 ml of normal saline to infuse at 100 ml per hour. The drop factor is that 10 drops per ml. The nurse should set the flow rate at how many drops per minute. Fill in box and round your answer to the nearest whole number. So on the Nclex, you write here your answer, and then you will submit the answer. Okay, so guys, this is really a very simple question. On the Nclex, you may not get such a calculation, and if you cannot really get the answer here, please you really need to work hard on your calculation. Usually these calculations come in pharmacology. Okay, they need you to determine doses. They will give you questions where you need to say convert milligrams to micrograms or vice versa, and then determine the dosage. They may need you to really convert something, but this is straightforward. You are given the drop factor, so this is easy. Okay guys, give me your answer, and then we go to the other side, and then we find out what the answer is. Okay, so the answer is 17. You can use a formula. I have given it there. This is from Saunders. So this is easy. Once you have the drop factor, then you know how many drops are in every ml. Already you have 1,000 ml, so you can know how many you can know how many drops that will go per minute if you already have such information. Alright guys, so I hope you got that, because that was very simple. So you either know, I really don't depend on this formula. I like doing things by first principles. First of all, knowing how many mLs, how many drops are in 1,000 ml. That is what I would really be looking for by using first principles, other than cramming. You know, sometimes cramming a formula, you may reach on the Nclex and it has already disappeared. So better train your mind to use first principle. Okay guys, number 9. A nurse is teaching a client with osteoarthritis about lifestyle changes. The nurse knows that the client understands the teaching when she states that she will avoid exercise, restrict caffeine, abstain from alcohol, avoid fatty foods. What is your answer, guys? Write your answer, go to the other side and find out what the answer is. The answer is D. Okay, so here they will really trick you. The trick here was avoid fatty foods. Another person would have put avoid weight gain, but they know that all these things are irrelevant in osteoarthritis complication except weight gain, and so they will not say it directly like weight gain, but they try to put foods that may make the patient gain weight. So the rationale is that excessive body weight is a risk factor associated with the development and progression of osteoarthritis. Weight reduction can decrease the manifestations of osteoarthritis. Okay. The last question, guys. The nurse performs a physical assessment on adult male. Identify the area where the nurse should place the stethoscope to auscultate heart sounds heard in the tricuspid area. When I used to review for my Nclex, I used to know that this is right. Okay, whenever I would see this, I would know these are the valves that separate the right atrium from the right ventricle. So whenever I mention tricuspid, I know this is right. Okay. This one gives it to me, right. Okay, so where would you auscultate? And so this format of questions is a kind of question that requires you to put a point. Okay, so you will on the Nclex you will drag and then click somewhere. Maybe it's hard here. Okay, all right, so maybe it's hard here or there. So where would you point, guys? So click somewhere. Okay, maybe it's here, first intercostal space, or second intercostal, third, fourth, fifth, sixth, whatever you want to click. Or maybe it is here, 1, 2, 3, 4, 5. Okay, so click. Maybe it is hard here, maybe it is hard here. Where would you auscultate, guys? Maybe you would click here in the epigastrium. So click somewhere and then let's see the answer. This is one of the format of the questions that you are likely to get on the Nclex. It is called hotspot question. Okay, so guys, I really don't like the way this Kaplan, the way they have clicked. Okay, the click should be here, it should be clear, it should be in the fourth intercostal space and near the sternum. That's where you get your where you put your stethoscope to auscultate the tricuspid sound. However, guys, remember that on the Nclex they give an allowance. So someone who clicks here may get, someone who clicks here may get, and someone who clicks here may also get. But you must not say click here or click here. Okay, you will so that's where we hear the first sound, the lab sound. Lab, remember, heart sounds are lab dab. Okay, so closure of the tricuspid valve occurs and can be auscultated here in the fourth intercostal space nearest to the sternum. Alright, guys, so this diagram, please do not go for your Nclex without knowing this diagram, because this is one of the common hotspot questions. Okay, guys, these are some of the materials I have used. Thank you so much for attending this test. What was your score, guys? Tell me here in the comment section, and I will be encouraged. If your score is 7 and above, I'm really encouraged and I'm confident that you can now go and attend the Nclex. But if your score is below 7, please keep reviewing, and don't get discouraged. This is possible. It is a mission possible. One day, I want you to come back on my YouTube channel and you tell me, I passed my Nclex exam, and that will be really a good day for me. Thank you so much, guys, for attending. If you find this useful, please subscribe, leave a comment, like, and share with your friends who are on the same journey together with you. See you again in another video. Bye bye for now.